Hi, good morning Mitchell. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 20th of December 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Mitchell Strauss.
Alright Mitchell, could you please confirm your candidate number?
Yes. My candidate number is 438337234.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Tell me about a time when you had to handle a difficult patient.
In a previous role, I encountered a challenging patient who was anxious and uncooperative. I first took the time to listen to their concerns, empathizing with their fears. I then explained the treatment plan in simple terms, ensuring they understood. I involved their family for support and collaborated with the healthcare team to provide the best care possible. This approach helped build trust, and the patient's cooperation improved.
How would you prioritize and coordinate a complex patient?
I would start by assessing the patient's overall condition and identifying any urgent issues. I would then communicate with all specialists involved to create a cohesive care plan. Prioritization would depend on the severity and urgency of each condition. Effective communication, collaboration, and regular reassessment would be key to ensuring the patient receives the best care.
How do you ensure that you provide patient-centered care?
Patient-centered care is essential. I always take the time to get to know my patients, asking about their preferences, cultural backgrounds, and individual needs. I respect their choices and involve them in their care decisions. By doing so, I can tailor the care plan to their preferences and ensure they are comfortable with their treatment.
Can you provide an example of a time when you had to work as part of a healthcare team to achieve a common goal?
Certainly. In my previous position, we had a complex case that required collaboration among nurses, doctors, and support staff. I actively contributed to team meetings, shared insights, and offered assistance when needed. By working together and utilizing each team member's strengths, we successfully managed the patient's condition and achieved our shared goal of delivering quality care.
How do you handle conflicts with colleagues or superiors in a professional setting?
Conflict resolution is crucial in healthcare. When conflicts arise, I strive to address them calmly and professionally. I prefer open communication, so I would approach the person involved and listen to their perspective. I express my own concerns and seek a mutually beneficial solution. If the conflict persists, I'm willing to involve a supervisor or mediator to find a resolution that prioritizes patient care and team harmony.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good afternoon, Mihiraa. I'm Mitchell Strauss, your nurse for today. I understand you've been feeling unwell. I'm here to discuss your treatment plan with you and get your consent for the procedure. How are you feeling today?
Thank you, nurse. I've been having this terrible nausea and vomiting, with some pain in my stomach. It's been making it hard to even keep water down.
I see. That sounds very uncomfortable. Don't worry, your doctor has recommended a treatment plan to help settle your stomach and give it a chance to heal. I'm here to explain everything and answer any questions you might have.
That's good to hear. Please, do tell me what we're looking at.
One of the things we'd like to do is insert a nasogastric tube, or NG tube for short. It's a thin, flexible tube that goes through your nose, down your throat, and into your stomach.
Through my nose? That sounds a bit scary.
I understand your concern, Mihiraa. It may feel strange at first, but it's a very common procedure and helps in many ways. The NG tube allows us to give you fluids and medication directly into your stomach, bypassing any blockages that might be causing your discomfort. It also helps relieve pressure and gas, which can ease your nausea and pain.
I see. So, it's like a little helper to get my stomach back on track?
Exactly. Think of it as a temporary measure to give your digestive system a much-needed rest while we address the underlying cause. Now, the insertion itself is quite simple. You'll be sitting up comfortably, and we'll gently pass the lubricated tube through one nostril. You may feel some tickling, but just try to swallow as instructed, and it will slide down smoothly. Mihiraa, do you have any doubts?
Okay, that sounds manageable. But still, I am concerned. Is it really necessary?
Mihiraa, it is quite natural to feel doubtful. Emphasizing the importance of the nasogastric tube is crucial in alleviating any apprehensions you may have. Firstly, the tube aids in gastric decompression, efficiently removing excess fluids and gases from the stomach to provide relief from discomfort and potential complications. Additionally, in cases of bowel obstruction, the tube acts as a gentle guide, helping to clear blockages and restore normal digestive function. This not only addresses immediate symptoms, but also contributes to your overall comfort and recovery. I hope your concerns are clear now. Do you have any concerns?
Yes, it is clear. By the way, how long will I have to have this tube in for?
Mihiraa, unfortunately, I can't give you a specific time frame right now. Every patient recovers differently, and it will depend on how your body responds to the treatment. Be comfortable. Your doctor will keep you updated and discuss the removal process in more detail later.
That's all right. As long as it helps me feel better, I'm willing to cooperate.
That's wonderful to hear, Mihiraa. Before we proceed, do you have any questions or concerns you'd like me to address?
Well, honestly, I'm a bit nervous about the discomfort. But it's okay.
You might experience some slight discomfort during insertion, but we'll do everything we can to make it as comfortable as possible. Mihiraa, remember, the benefits of the NG tube far outweigh any temporary discomfort. Now, Mihiraa, can I have your consent to proceed with the NG tube insertion?
You're right. Okay, I'm ready to give it a try.
Excellent. Just be comfortable, and we'll begin the procedure shortly. Remember, we're here to support you every step of the way.
Thank you. I feel much better knowing I have someone like you looking after me. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.